So what did we do? First of all, we shielded all the registration areas with plexiglass so that if there were droplets or something, they would not reach the nurses because they had plexiglass. We have the duty to wear, the obligation to wear masks. So I'm wearing a mask all the time when I see patients or when I'm in contact with my colleagues, and the patients also wear masks all the time. As soon as they enter the hospital, there is a security guard who checks if the patients are wearing their mask, so that both the patients and also the staff of the hospital wear masks constantly when they are in any contact with the patients. I think that is very important. The next measure was that we are carefully observing that there should be an appropriate distance between patients and staff of at least 1.5 meters. So we put markings on the floor in order to show the patient, signify that this is a distance of 1.5 meters and the patient should not approach each other. The next very important point is we keep our windows open all the time. Of course, luckily now the weather is fine, it's not so cold outside, so that we are constantly airing the rooms. Obviously, there are the usual things that we do, disinfecting our hands, disinfecting the tables and so on where the patients had contact. All the pens where the patients need to write down things are used only once and then disinfected. So this is another measure that we do. And actually, as of today, we have the Corona warning app in Germany, which actually I just downloaded a couple of minutes ago. So that is assessment of the risk if you had been in contact with a patient. It is has very high rules of data protection, and we also hope that we can identify any additional risks in order to keep our patients safer. All the new patients receive a phone call beforehand informing them that they have to wear masks, that they have to be there on time, and that they should come alone. So we don't want to see an entire family surrounding the patient, because that would have additional risk. If the patients have any signs of infections, they should not come to our hospital. They should inform us, and we will take measures, and that depends on what kind of signs of infection they have.